Hi everyone, we will give it a few more minutes as people enter the room and then I'll make a start. Right, I think we'll make a start now. Thank you everyone for attending and for your time here with us. My name's Elizabeth Griffiths and I'm Assistant Director of Public Health here at Birmingham City Council. Before we start, I've got the standard slide with housekeeping, so if we could move over to that, we'll just go through some of the housekeeping rules for the session now. Can we move to the next slide, please?
Yeah.
Thank you.
Can you see it? I can't see it for some reason.
No, I've still got the main page.
Sorry. Yeah.
Here we go. So as with normal Zoom and webinar sessions, if you could stay muted and turn off your camera while the session is on. Use the chat. If you want any questions, please make a note in there and we'll be able to raise those with the speakers as the session goes on. And we're recording the session. So if you did want to see it at a later date, you'll be able to through Healthy Birmingham, and we'll also be putting it through our YouTube channel. So let's move on. This is the first in a series of webinars that we're hosting on diet, nutrition and health. And the reason that we have decided to run these is that last year we launched Birmingham Food Conversation as part of the information gathering for our food strategy that we'll be producing later this year, that my colleague Kyle will be telling you about later. Some of the findings that we had from the Birmingham Food Conversation through our surveys, focus groups and seldom heard voices work that we had with community organisations was that people don't really understand enough about food and health beyond the main headlines. And so we've created this webinar series to give frontline officers extra information so that you're able to answer questions from members of the public about food and nutrition and the impact that that has on health and well-being. So if we could, all right, sorry, we're already on the slide. So the outline of the session today is obviously welcome now. I will do a very short introduction to the webinar series, and then I'll hand over to my colleague Kyle Stott, who will be talking through the work of our Creating a Healthy Food City Forum, work across the food system that we're doing in the City of Birmingham, the development of our food strategy, and also how that links into our wider health and wellbeing work and our emergency food plan. And then I'll hand over to Vasuda, who will introduce some of the concepts around diet and nutrition, give a general overview before we launch into the webinar series that go into more detail. So if you could, next slide, please.
Yeah.
Okay, so the ambition of this webinar series is really about raising awareness. As I said, giving you the tools to be able to answer those questions about diet, nutrition and health. And we intend to do this by offering a series of webinars. So each week we'll have a different group of experts who will be talking in depth about different aspects of diet and nutrition. I think we've got 8 sessions over the next 9 weeks. And we'll be showing how we're incorporating this evidence, this knowledge, and this way of working into our own work and planning. And Kyle will talk through some of that with the Creating a Healthy Food City Forum group. So we'll also be increasing our understanding of the evidence, and in particular, Vasudha is doing some work around understanding differences in diet and the impact that we've got on different groups in the city of Birmingham, or those with different disease conditions. Also that we can tailor messaging around how to improve diets. Next slide, please. Yes. Thank you very much. Okay, so the way we're running this webinar series, we'll be looking at nutrition across the life course. So we've got here child nutrition, maternal nutrition and health. We'll also be drawing on national guidance, for example, the Eat Well Guide, which is evidence-based recommendations to achieve healthy, balanced diet. And that's through dairy, lean protein, whole grains and carbs, fruit and vegetables, and including a few of those high sugar, high fat snacks and food and drink that are all depicted in the Eat Well Guide. We'll be talking through some of the tools that are available to manage a balanced diet. These are things like portion control, self-weighing and recording of weight, setting yourself goals, planning meals, snacks, and getting social support. We've also got a detailed look at food poverty as part of the webinar series. And then we'll be looking through the very complex relationship between diet and mental health and well-being, this cyclical relationship that can also lead to an impact on physical health as well as mental health. Okay, I think this is the programme that we are running the webinars on over the next 9 weeks. Today, obviously, is an introduction and our general overview, but the future sessions will take a much more detailed look into these different aspects of food and health. We'll also close the series with a roundup session that will help us identify next steps moving forward. So thank you for listening to me. I really hope that you'll find this series useful. I look forward to seeing you in the great numbers that we've managed to achieve so far at all of our sessions. I just want to leave you with a message that maintaining a healthy weight is really one of the most important things that you can do for your health. And so I really strongly encourage you to take the time to have these conversations with members of the public that you come into contact with through your normal service delivery. So thank you. I will now hand over to my colleague Kyle Stott, who will talk about our work on creating a healthy food city and also our emerging food strategy. Thank you.
Thank you, Elizabeth. Kyle, could you please take over?
Yes, of course, Vasudha. Thank you, Elizabeth, for that introduction. Thank you, Vasudha, and thank you for everybody for attending today. It's a really good turnout. So just before I go into my slides, just a bit of an icebreaker, I suppose. In the background on my video, that's not actually my back garden. If anybody's thinking that, it's nothing so grand. That is actually the Aga Khan Palace in Pune in India. That was built by the third Aga Khan, and he actually built it and gifted it to the city to actually help to alleviate famine and to actually promote food choices and healthy eating across that city in India. And you may be saying, well, why do we have that? We're actually in partnership with Pune in India with reference to food and looking at how we create more accessible food for everybody, more healthy, nutritious, routine opportunities. So that's why that's there. I'm just going to put my slides up now. I'm just going to share my screen. So bear with me. Okay, so you should all be able to see those slides. I'll just pop it onto a slideshow as well, so it's easier for everybody to view. So I'm going to give you an introduction to the Healthy Food City Forum. And what that really is, it's as it says here, it's a subgroup of the Health and Wellbeing Board for Birmingham. And the purpose of the forum is to work together. It's a whole system approach. It's a co-produced piece of work. Because if we don't do that and we don't actually approach food and nutrition in the city in that way, then we will not achieve our aims and ambitions, which I'll go through in a short while. So that underpins the actual forum itself. It's to apply a whole system approach to understanding the food landscape of the city and to improve the food behaviours at a population level across the city as well. And that's by ensuring that a joint action plan is developed and delivered, which is something that we're working on and I'll talk about as part of the strategy and also the emergency food plan as well. I'm pleased to say that the forum is chaired by Councillor Paulette Hamilton. She's a cabinet member for Adult Social Care and Health, and Public Health sits within that as well. And she also chairs the Health and Wellbeing Board here in Birmingham. So there's very, very good alignment there with the portfolios that we have across the city that are absolutely implicit in the delivery of a healthier food city. Just moving on, just talking about health and wellbeing boards really quickly. When we share these slides, you will be able to click on some of the hyperlinks that I've put in that will take you to a better explanation of what a health and wellbeing board is, and also taking you to our membership here in Birmingham as a health and wellbeing board and what that means. They were established under the Health and Social Care Act in 2012, and it's a statutory obligation of every local authority to have a health and wellbeing board. And they became fully operational on the 1st of April 2013, and in all 152 local authorities have one who have adult social care and public health responsibilities, of which Birmingham is one of those. I'm pleased to say that our membership here in Birmingham includes all of those people listed, or all of those organisations listed and representatives from them. So as you can see, it's a very robust coverage of the Health and Wellbeing Board. And the Creating a Healthy Food City Forum is a pillar of that Health and Wellbeing Board. It's a subgroup of that Health and Wellbeing Board. And it is actually there to specifically focus on food for Birmingham. So the forum is represented in our city by over 26 individual organisations, and that's made up of the public sector, the voluntary sector, the private sector. So there's an absolutely huge wealth of organisations there. From a grassroots perspective, all the way up to the top and down again, everybody has a level playing field in that forum, and everybody is invited to participate, and everybody is invited to present at some stage in that year with that forum runs. So it's supported by a robust terms of reference, which I won't go through, but they are available, and it meets once every 2 months. And just to go through the governance for you, just so that you can see that it is a group with a lot of teeth. A performance report is produced to summarise the work of the forum, and that includes any actions and outcomes agreed or completed. And this is provided to the Health and Wellbeing Board once every 2 months, and cabinet member briefings are also provided to ensure that the work of the forum is progressive and it's also sustainable. And that's a really, really important thing, is that these types of forums are progressive and they are sustainable. So just moving on, just to go through the objectives of the forum. The first one is to deliver a joint vision for addressing current obesity levels in the city and to exploit opportunities for joint working. And as you'll see in some of my other slides, you'll see where that actually happens and how it happens. It's also to develop a robust action plan that will underpin the delivery of the Health and Wellbeing Board, food and obesity priorities and indicators, and also to provide a strategic direction and seek alignment with the work being undertaken throughout the other relevant work programs and boards as well, because we do have other boards. We have a physical activity board. We have different forums. We have a physical activity forum, we have a mental health forum, we have an inequalities forum, and there are others as well. And as Elizabeth has already alluded to in some of her slides, mental health and food and nutrition go hand in hand, and so does physical activity as well. So it's very important that we actually have cross-cutting themes and we actually make those linkages as well. It's also, the forum is there to contribute to the development of the JSNA, or the Joint Strategic Needs Assessment. And I've put a link in there as well that you can follow that will take you to the pages in Birmingham that explain in more detail what a Joint Strategic Needs Assessment is. It's an assessment really of the current and future health and social care needs of the people of Birmingham. And that's ongoing, that's always being refreshed and always being looked at, and it's part of the forum's job to actually feed into that process and to also take the learning and findings and insight that the JSNA can give to actually inform the aims and objectives and actions that the forum takes. The forum's actually also there to contribute to informing the commissioning intentions of the city and its partners, and to also provide a steer to the Health and Wellbeing Board as well. And it's also there to promote and facilitate coordination between partners and partnerships to consider what agendas and resources might be shared more effectively where appropriate. And again, that all comes back to this whole system approach and this co-produced methodology that we should and need to be following. And as I've already explained, it's also there to report and support the activities of the Health and Wellbeing Board. But again, that is implicit. A very important one as well is to promote communication and engagement with the stakeholders and the residents of Birmingham relating to, sorry, it actually says a physical activity agenda there. That should actually say the food agenda. I've no idea why that's there. I do apologise. These are my slides. So that's actually with reference to the food agenda. And as you can see, that's really important because, as I said earlier, we have over 26 organisations that represent the forum, and that's growing all the time as well. And there's actually a wider forum too. So there's a wider membership to that forum, but the core members is made up of 26 organisations. It's also to promote best practice and sharing of ideas, including collaboration that leads to maximisation of external funding opportunities. And we've been successful recently with some funding, which I'll go into in a short while. And it also will oversee performance and it will address areas for future development and improvement. So it performance manages itself, but it's also performance managed through the governance structure in the context of feeding into the Health and Wellbeing Board too. So it's a very robust forum. I'm really pleased to be part of it. So if we just move on, this now looks at we're now going into the realms of how the forum actually links in with other stuff in the city that actually supports creating a healthy food city. And this is a draft of our intentions for creating a healthier city strategy. And that draft will be out for consultation at some point this year, as will the draft food strategy for the city. That goes out, it should go out for consultation in August of this year as well. And as you can see there, creating a healthier city is a shared vision where every citizen at every stage of their life in all communities can make healthy choices that are affordable, sustainable and desirable to support them to achieve their potential for a happy, healthy life. And that cuts across food as well. So it's very, very important that everybody in every community can make healthy food choices that are routinely affordable and are sustainable as well, and also contribute to the potential to have the healthiest and happiest life possible. We know that there are discrepancies in the city with reference to life expectancy and healthy life expectancy, and food and nutrition undoubtedly plays a part in that. So just moving to this circular model for a second and looking at the 10 points on there, you can see where food cuts across all of those. It does cut across a life course. We know that there are certain foods and certain nutritional values with reference to the life course. We know that food is a huge concern with reference to equality and diversity. We also know that food does play a part in COVID recovery as well. We know that certain nutritional aspects, such as vitamin D, have an impact on COVID. And we also know that a healthier diet can promote a healthier immune system too. We're looking there from an environmental sustainability and climate change perspective, and we all know about things such as food miles, etc., and the impact that that can have on climate change and environmental sustainability. And then inclusion and vulnerability as well. So we see that every day through our creating a health, from a food poverty perspective. We can see that inclusion and vulnerability is a big issue that needs tackling in this city. So just going on to these 10 points within this model. So getting the best start in life, we know that food and nutrition plays a huge part there, especially with reference to breastfeeding. Mental wellness and balance, which we'll come on to in some of our other webinars, and we will unpick in more detail. Healthy and affordable food, that's the crux of it really. Going back to the vision that every person has access to healthy and affordable food routinely and in a sustainable manner. Working and learning well. Obviously, I'll talk a little bit with reference to food in the context of working and learning well, because it does cut across our spiral curriculum. And aging well and dying well, obviously food is very, very important throughout the life course with reference to older adults, and closing the gap as well. That's with reference to health inequality. So it's about closing the gap with reference to those people that have those options and opportunities now, and those people that don't. So it's very, very important that we close that gap. And also food, going back to environmental sustainability and climate change, plays a huge part in contributing to a green and sustainable future. And also it does actually play its own part as well in mitigating the legacy of COVID. We have seen a phenomenal increase in the amount of people that are using our food banks during COVID. And we're also moving forward in September to when furlough finishes as well. And undoubtedly, the forecasts do actually tell us that there probably will be an increase again in our usage of food banks and other support mechanisms for food and nutrition. So you can see there how food actually cuts across all of those different boxes within that model for creating a healthier city. So I think it's fair to say that food has a ubiquitous role across almost everything that we do. So just moving on, there are 9 proposed key actions that underpin the draft health and wellbeing strategy with reference to healthy and affordable food. And I've listed them there for you. I'll let you digest those, but I'll just pick some of them out. So as an example, the implementation of a healthy city planning toolkit. That's a toolkit that at the moment sits with public health. It is out for consultation, and hopefully one of my colleagues can drop the link to that consultation in the chat. If you haven't already filled in the consultation, we'd welcome your input. Creating a healthy a healthy city from a planning perspective, that's actually about the built environment and creating what we call a salutogenic environment or a health-giving environment, as opposed to an obesogenic environment, which would actually promote would actually not promote overweight and obesity, but contribute to overweight and obesity. So we actually want to move away from that. And there are 14 different indicators in the toolkit, and one of them is actually with specific reference to food. And an example of an indicator within that would be, how can we actually ensure that if a new development is taking place, such as the one that's proposed for the green belt in Sutton Coldfield. It's going to be 6,000 new homes. The toolkit will ensure that things like monopolisation of food doesn't actually occur, and that food choices are designed in so that people have a much richer and sustainable opportunity to have a healthy and nutritious and affordable diet, as opposed to being very restricted with what they can do. Some of the other things as well, such as number 5, maximising the healthy food benefits of the East Birmingham corridor development. So as many of you are probably aware on the call today, the area of East Birmingham is actually going through a redevelopment program. And one of the things we are doing is working very closely with the team that are leading on that. One of the things we want to do is to create a sustainable food system throughout that corridor. We're working with the Forum, and we're also working with other partners to understand what that looks like. So that's an example of one of those key actions as well. Maximising benefits of the food poverty core group and food justice network. That's an extremely important one, because that's actually looking at prevention and early intervention, so that and looking at closing the gap with reference to inequality and inequity around food. And obviously, with the increase in the usage of food banks during COVID, that work is extremely important. And I'm really pleased to say that there's a lot of wraparound work going on around that as well, because the immediate issue is ensuring that people have access to healthy and nutritious meals, but it's also about supporting them in unpicking what's actually happened as to why they've arrived there. So that is actually looking at not just the supply and demand, but also the wraparound preventative and early intervention opportunities too. So I'll move on due to timings. So these are some of the indicators that we hope to use. They are in draft format, and you will see them out for consultation as we move through the year with reference to the creating a healthier city strategy. And these are some of the indicators that we're looking at that will feed back into the work of the Forum and then back into the work of the Health and Wellbeing Board as well, and vice versa. So as you can see, increasing the percentage of babies who are breastfed from 50% by 2027 to over 60% by 2030, extremely important that we give our children the best start in life. And we know that that is an absolutely essential target with reference to health inequality. Increasing the uptake of Healthy Start vouchers in eligible families to at least 80% by 2027. Reducing the percentage of 5-year-olds with visually obvious dental decay to below 20% by 2030. And it's implicit that obviously food and nutrition and dietary habits have a very, very strong impact on our dental health and our oral health. Reducing the prevalence of obesity, including severe obesity in children in reception in year 6 by 10% by 2030. And currently we actually do see an increase in overweight and obesity in our children as they go through the primary years at school. So it's about how we actually halt the rise of that and actually start to move it backwards as well. And then it's to reduce the prevalence of underweight in children in reception in year 6 to less than 1%, because it's not just important to focus on overweight and obesity. As I said earlier, it's about giving every child the best start in life. And it's also important that we pick up on underweight as well and look at reducing the prevalence of that. One of the things that actually happens there is that through the NCMP program, the National Child Measurement Program, that's actually picked up. So it's not just about measuring children who are overweight and obese. We actually do detect children who are underweight as well. So that gives us a very good understanding of what we need to be doing and where, and what we need to be targeting and why. Increasing the percentage of adults regularly eating 5 a day to more than 55% by 2030. Again, extremely important target. And then increasing, actually going into that as well, increasing growing spaces within Birmingham. I was only at a meeting this morning with reference to increasing growing spaces, and the amount of energy in that room is very exciting. It's really refreshing to be sat with like-minded people that are actually looking at how we can increase our growing space, both from an industrial perspective, so a large perspective, and also right down to really micro community level. So the conversations that were taking place this morning included things such as how can we actually identify all of those spaces that this is currently happening in, so that everybody has an opportunity to be involved if they want to and know about it, but also to map out opportunities where growing isn't taking place but might be able to take place, and how we actually unpick the quite complicated processes for unlocking that space to make it easier for people and groups and communities to actually get their hands on that growing space and be able to produce for themselves and others. And also to ensure that the Healthy City Planning Toolkit is utilised in 90% of developments in the city. Again, this will be going out for consultation, and that's very ambitious. Personally, I hope we can meet that target, but we'd like to hear back from you all when this all goes out for consultation. Certainly the Healthy City Planning Toolkit should be used in all major developments in the city. So that's anything from 10 homes or more, and anything of 10,000 square metres or more of commercial. And that's something that we should be focusing on at a minimum, but it would be really, really good to see the toolkit utilised across 90% of developments, full stop. So I'll just move on there and give you some examples of work that the Creating a Healthy Food City Forum is delivering. And this actually dovetails then into the thinking of the strategy for food, and also the thinking of the strategy for creating a healthier city as well. So I've just picked out some of the things and tried to put them into some headings, because this is not an exhaustive list of everything that's going on in the city with reference to food that sits under the forum. There's such a phenomenal range of stuff that I'd be here all day talking to you about it. And that's why I'm pleased that there's actually a series of webinars and not just the one, because there's so much to talk to you about. So from a food poverty and emergency response, we have a food poverty steering group, and that is sat within the Financial Inclusion Partnership. And that actually does look at prevention, early intervention, and how we can actually help people to not relapse as well. So going through the full cycle of food poverty, the Food Justice Network is looking at how we can ensure that everybody in the city has access to healthy, nutritious and routine food options, and looking at closing the gap with reference to inequality and inequity. They did do a phenomenal job. The emergency food plan, that was written and that was adopted by the forum with reference to COVID. So it was actually about looking at what we need to be doing now and what we need to be doing moving through COVID, and also as we move into recovery. And that actually underpins all of the actions that we can and should be doing. And also with reference to food poverty and emergency response, we're doing some work around insight into food bank usage. So we actually have that information that you can't buy really at a really grassroots level, at a micro level. So we can start to understand where things are happening and where supply and demand is. And also to actually then be able to focus our efforts on how we prevent and intervene at the earliest opportunity. We're only going to be able to do that if we have access to good quality data and good quality insight. So there's a piece of work that's happening around that as well. And just moving on to the Childhood Obesity Trailblazer, there are 3 items within that, and this is actually funded by central government funding through the LGA. So the Birmingham Basket is similar to the National Basket that some of you may be aware of. So the National Basket is actually something that is produced every year and actually informs us what people are buying and why. And the National Basket, we suspect, doesn't actually give us a very clear view of what people in Birmingham are buying. It's a huge city, absolutely super diverse city with over 130 languages spoken. And we think that the national picture doesn't necessarily reflect the local picture. So one of the things that we're doing in the Trailblazer is we're creating a Birmingham Basket, which actually looks at consumer habits in the city around food. And we hope that that gives us a far better insight into what people are buying and why, and helps us to shape our the way in which we commission our services and the way in which we actually deploy our services and our facilities across the city in a way which means that those people that need it most get it first. Again, it's looking at quality and equity of food. Creating a healthy city planning toolkit. The toolkit actually is one of the outcomes for the Obesity Trailblazer, and we're moving forward with that. And as I said, it's out for consultation at the moment, and we are hoping at some point to actually give the toolkit the teeth that it needs. It's got some teeth, but what we would like to do is see the toolkit actually adopted into local planning policy. And as part of that, we need to go out to public consultation, which we're doing at the moment. The spiral curriculum is a very exciting piece of work, and that is actually that's a learning piece of work, whereby a curriculum around health, specifically food and nutrition, is being produced that will be embedded into the actual learning journey of all of the, in the first instance, our apprentices throughout the local authority, but then looking at how we roll that out wider across the city. What we're hoping, the ambition is to actually have a health curriculum that we can embed into people's learning journeys across the city at every level. So the curriculum starts at level 1 and goes through to level 7, and it starts with some very, very basic things at level 1, such as why we should be eating a healthy and nutritious diet. And at level 7, you're actually looking at education that allows our decision makers, our policy makers, our executives across the city to embed food and nutrition decisions into their policies and their decisions as well. So that curriculum is very, very broad and very detailed. It's not been produced yet. It's in the process of being produced, and we hope to roll it out at some point this year. And then just finally moving on to partnerships and collaboration. This is just a snapshot of some of the partnerships and collaboration that we have in the city. So one of the things you'll hear about in far more depth in the near future is WISC. And WISC is an organisation and a platform that we commissioned to build 2 different platforms, a business-to-business platform and a business-to-community platform. And the business-to-business platform invites local businesses to upload their menus into a system that's online. And through a very, very robust database, that system will actually tell that organisation if that menu or that recipe on that menu is healthy or not. It will generate a health score. So what we're actually hoping is we can actually support businesses throughout the city to influence healthier menus and healthier recipes. And then from a business to community perspective, that's a free platform for sharing of recipes. One of my colleagues will speak in far more depth about that in one of the webinars, but what I would ask is if one of my colleagues could drop a link to that free platform into the chat so that people have access to it. That'd be really, really helpful. I did touch upon Bindi and Pune, and I touched upon the Milan Urban Food Policy Pact. So the Bindi Pune relationship is actually about how we can work with another city internationally to look at how we can influence our food and nutrition system. From a Milan Urban Food Policy Pact perspective, it's about maximising political aspects across European countries for the benefit of the food system. In other words, using our political levers at the highest level, and also by pooling that resource at the highest level to see if we can actually influence changes and benefits in the food system that we can then take and implement at a local level. And I'm really pleased to say that Councillor Hamilton, the cabinet member for adult social care and health, is actually represents Birmingham on that committee, the Milan Urban Food Policy Pact Committee, which is fantastic news. I've already talked about the East Birmingham Development Corridor. We've recently been awarded a Sustainable Food Places grant, or an SFP grant, which we're looking at how we roll out over in the near future, looking at community food growing. Commonwealth Games and food dialogues, they're taking place very soon, and we should hear about those in some more of our webinars moving forward. Horizon 2020 looks at innovative solutions to a whole system approach to food, and invites organisations to bid for money into basically a living lab that enables delivery of those innovative concepts to actually break the mold of how we do things, because it sort of goes back to Einstein's theory of insanity, doing the same thing over and over again and expecting different results. The Horizon 2020 program is actually there to challenge that very thing that we sometimes do. Co-farm, that's looking at how we can grow local from farm to fork, but also from a micro perspective to an industrial perspective. And there's some very exciting conversations going on at the moment. And then seldom heard voices, which I think Elizabeth talked about earlier, that actually informs our strategy for food and also the creating a healthier city strategy as well. So seldom heard voices is all about engaging with those people who we seldom hear from, to give them a voice and to ensure that we can capture that insight that we don't routinely have, because it's extremely important that we actually gather that insight to help us to make the correct decisions moving forward. So that's just a snapshot of what we do and how we do it. And when I say we, I mean the Food Forum in the city. And all of this also underpins the emerging food strategy as well for Birmingham, and also feeds into the healthier city strategy, or the emerging healthier city strategy. So hopefully I've given you a broad overview and a good snapshot of the forum, of the work of the forum that feeds into the strategy, and also what's going to be happening in the near future with reference to consultation on both the food strategy and also the healthier city strategy as well. So I think that's all of my slides really. I'll invite any questions via the chat, but I'll hand back over to Vasudha.
Thank you, Kyle. Thanks a lot for your presentation.
You're welcome.
Okay, put up my presentation. Good afternoon, everyone. Thank you for joining today's webinar launch of Diet, Nutrition and Health webinar series. My name is Vasudha Jeve. I'm one of the GP registrar. I'm currently working in public health and organizing this webinar series. As you already know, this is our webinar schedule. And today I'm going to give you a concept, some general concepts around food, nutrition and health. Just a minute. Yeah. As you know, diet, nutrition, and health is a very broad topic, and we are going to cover this topic in depth in our subsequent webinars in this webinar series. But today I'll just give you some basic concepts around diet, nutrition, and health. So what is nutrition and why it is important? Nutrition is the science of how the body uses food to support functions like growth and repair at all stages of life. Nutrition lies at the heart of health for every individual. And it matters because excess or lack of nutrients may lead to illness. We get nutrition from food we eat. So let's talk about food. So food contains macronutrients and micronutrients. Macronutrients are proteins, carbohydrates, and fat. They provide energy, that is calories, to fuel the body. And micronutrients are vitamins and minerals. They support critical functions in the body. So what happens if there is deficiency of macronutrients? So deficiency of macronutrients leads to malnutrition. So the first picture is about malnutrition, whilst the second picture is about what happens when there's excess of macronutrients, which is obesity. Now let's talk about micronutrients. Micronutrients are vitamins, minerals, and trace elements that are essential nutrients that our body needs, but in smaller amounts. And the actual amount your body needs may vary depending on your age, the physical activity you take, your medical history, your gender, and it's different for pregnant women, breastfeeding women. So there will be more demand of those micronutrients in these groups. These imbalances, deficiencies can cause different symptoms. I have put a slide here to show what happens if there is iron deficiency. Iron is a trace element that our body needs for critical functions. And if there is a deficiency of iron, we can develop anemia and can get a variety of symptoms like racing of your heart, dry skin, drowsiness, pallor, nail changes, fragility of hair, cracked lips, weakness, fatigue, flashing lights and stuff like that. So let's move on to the next. So it's very important to talk about energy in regards to nutrition. So we all need energy to grow, stay alive, keep up warm, and be active. Energy is provided by carbohydrates, proteins, and fat in the food and drinks we consume. The amount of energy a food contains is measured in kilocalories or kilojoules. The energy in food per gram is sometimes described as energy density. So we can therefore describe fat as more energy dense than protein or carbohydrate because it contains more energy. I've got a next slide on energy. So energy is, we see these concepts everywhere about energy, kilocalories, and just wanted to show you what it means really. So energy is measured in units of kilocalories or kilojoules. So 1 kilocalorie is equal to around like 4.18 kilojoules. So fat contains more energy, that is 9 kilocalorie per gram. Alcohol, surprisingly, which I didn't know either, contains around like 7 kilocalorie per gram. And protein and carbohydrate, protein contains 4 kilocalorie per gram, and carbohydrates contain 3.75 kilocalorie per gram. So striking the right energy balance is really important. So if the more calories are consumed and less are burned, then the effect is weight gain. And we are going to talk about portion sizes and stuff like that in our subsequent webinars to maintain a healthy weight, balanced weight. As you can see, if the balance, to keep the balance equal, we need to keep the intake and output same. And on the other hand, if the calories eaten are less compared to the calories burned, then a person loses weight. So to guide us on a balanced diet, to help us achieve a healthy weight and good health, government has produced a Eat Well guide. So we are going to talk in detail about Eat Well guide in our subsequent webinars, but I've just got this slide to, because this topic would be incomplete without this slide, just to show what government is doing. And yes, as I said, we are going to talk in depth about Eat Well guide in our next webinar on healthy eating. So basically, these are the main tips about the Eat Well guide. Okay, moving on to next slide. I'm mindful of time. Yeah, so it's not always easy to follow the Eat Well guide. There are many barriers to the Eat Well guide, and there are different factors that influence our health, starting from as Kyle also mentioned, that how we are working on these different factors. So like it starts from age, sex, and constitutional factors, and then after that there are individual lifestyle factors, then social and community networks, followed by agricultural, food production, education, work environment, living and working conditions, unemployment, water and sanitation, healthcare services, housing, general socioeconomic and cultural and environmental conditions. So there are lots of barriers to healthy eating, and it's really important to address those barriers and break those barriers. So in our webinar series, we are also going to talk about these barriers and how to break them in great depth. So we have got a seminar webinar on food poverty and what we are doing and stuff like that, and housing as well. So for homeless people, what we are doing, and for people with limited material to cook, like some people may just have a kettle to cook. So what we can do in those cases. So we are going to talk about all these things in great details in coming webinars. Moving on to next slide. So this is the slide which shows the percentage of adults classified as overweight or obese in Birmingham and cities around the Birmingham. So as you can see, we are not doing great here. So the red bars, the red areas indicate that compared with the national average, we are not doing well here. And there are few amber bars which show that we are doing similar to the national average. Therefore, it's very important that we focus on diet, nutrition, and health to catch up with the national average, or possibly do better here. So hopefully this webinar series will provide with tools and support to achieve this aim. Yeah, thank you. Thank you. Any questions? We'll come back to all your questions after this presentation. So thank you very much. I'll stop sharing and we'll go to the questions. Thank you. Yeah. Landry, are there any questions for us?
Hi, thanks, Vasudha. I've been keeping a view of the questions as they've been coming up and have put responses in the chat as they've come through. Please, could you put the slide of our forthcoming webinars back on the page so that we can,
yes,
so people are able to see which ones are coming up?
Yes.
So if there are any more questions, please do indicate in the chat and our team here will be able to respond. If not, I mean, thank you for your time today. As I mentioned, this was a general introduction to the diet and food and health agenda. Our future webinars will drill into some of the details, so you'll have much more information to be able to respond to any questions that come up around poverty and health, or mental health and well-being, etc., etc. So I can't see if there's any more questions coming. I think that's probably because they're on a different slide. Thank you. So absolutely. So I think the only other question that we've got is around equality and diversity. I can absolutely explain what those are. So we look at diversity to mean the many different population groups that we have in our society, and this could be in terms of deprivation, so how deprived an area is, how rich other areas are, the quality of housing that there might be in different areas. We can also look at diversity in terms of age. So in Birmingham, for example, we have a really large young population compared to some of the areas like Worcestershire that has an older population. We can talk about diversity in terms of ethnicity or in terms of faith. or in terms of physical or mental disability. So there's a wide different way, lots of different ways that we can look at diversity, and the comments that have been raised are really about trying to understand the impact of some of those differences and how that might come through in terms of the diet that people eat, and then the subsequent impact that those diets or those behaviours, those choices, those social networks have on those people's health. So we will certainly be exploring different aspects of diversity through the webinar series, and hopefully some more of those questions will come through. In terms of the question about equity, this is about the level of support that different groups might need. So it might, in some situations, it's appropriate for everybody to receive the same level of service, but in other areas where perhaps there's much more need, we might need to target some of the services or the interventions that we're delivering so that there's more support for certain groups and slightly lesser support for some of the people that aren't so much in need. So hopefully that has given you a very brief question of that question. Happy to answer any other ones, and of course we'll get much more detail as this webinar series goes through. Is there any more questions? I think we've been able to pick everything else up. Can the team tell me if there's anything that we've missed?
No, I don't think so, Elizabeth. I'm just going through the chat. No.
All right.
Thank you.
That's lovely. Well, one more. COVID impact survey. Absolutely, I can go through that. So at the last year, we were trying to understand within public health the impact that COVID has had on our population. So we sent out a questionnaire, quite a detailed questionnaire that really tried to drill down into people's thoughts about their behaviours over COVID, for example, how much exercise they were getting, the impact on their food choices, whether there was any impact on mental well-being, for example, and their connectedness to their local areas. We got those survey results back, and we are repeating that now so we can observe if there's any further changes. We've got the COVID impact survey that is live, and I will ask my colleague Mel to put that link into the chat and really encourage anyone to put their views forward in there so that we can capture the impact that COVID has had on our city. I think that is everything now that has come through. We will be sharing those slides with people that attended. As I mentioned earlier, this recording will go on our YouTube channel, and we'll also have it available through Healthy Brum. And our subsequent webinar series will be publicised in the same way. So I do hope you will join us for our future ones, and I look forward to hearing your questions. Thank you very much for your time, everyone, and have a lovely day.
Thank you, everyone. Thank you, Elizabeth.